Dear viewers, today we'll be learning about interpretation of X-ray chest. Remember, X-ray chest is one of the very commonly performed radiological diagnostic procedure across the globe. And whensoever we have to comment on any given X-ray, we always look for more than one exposure. For X-ray chest, we always look into a posterior anterior view and a lateral view. Remember, when you're approaching any X-ray, we should not forget this single line. You only see what you look for, and you only look for what you know. That's why it's really important when you are about to comment on any given X-ray, you need to have a brief history of that person. So when you start approaching to any X-ray, there are certain points which needs to be very clear. We have to be systematic, and we should always look for who's the person, the view, and all other date and everything, the location. These are important points. After that, we should be looking into the quality of the X-ray, because quality of the X-ray is really instrumental and helpful for determining all kind of diseases if they are there. We always follow the ABCD approach. What is this ABCDE approach? We always start from the airways, then we look for the lung and pleura, that is breathing, and then the C is for cardiomediastinal shallows. We should be looking in that for circulation, and then we should be looking for any kind of fracture to anticipate disabilities, and then anything else is coming under cover of the exposure. So this is how we can approach an X-ray chest. Remember, on this given X-ray, if you're looking at this X-ray, you can see there is something dark black, something is little bit grayish, and then you can see there are different shades of gray. Something is brilliant white. So these are so many factors. So what are these? What are they known? These are my densities. And when you are approaching a conventional X-ray, there are 5 basic densities. Air, it is always appear black. Fat, it appears gray. Then comes the fluid and the soft tissue. They are also in gray, but that is a different contrast, because this study is all about anticipating, differentiating between different contrast medias. Then the calcium, how it appears, because most of our bones, why they are appearing white? Because we all know they are rich with abundance of calcium, and this calcium, it absorbs a lot of X-rays, so that's why it appears most dense. And then the metal, there's no metal seen in this given X-ray, but they absorb all the X-rays, so that's why it appears the most white structure. So these 5 densities should be very clear in our mind. Now when you are looking into any X-ray, before giving any clinical diagnosis, we should be looking for the technical adequacy of this given radiograph, and for that there are 5 technical factors. What are these technical factors? We should be looking for the penetration, we should be looking for the inspiration, we should be looking for the rotation, magnification, and angulation. How we do it and where we do it. First of all, when we approach to this X-ray, we all know this structure here is the heart. So now, if I see through this heart, I should look for, can I see these vertebrae here? If they are easily visible to me, that tells me one very simple factor, that exposure is perfect. So penetration is good. So there is no issue. This is a very important factor, and that helps me to comment upon the penetration. The second point is, that is what? That was inspiration. We always look for inspiratory films. Why? Because you have noticed when somebody is undergoing an X-ray chest, the technician always asks, take a deep breath and hold. Why this is being asked? because we want a lung fully expanded in the given pleural space. So we need to look into an inspiratory film. How we can confirm that this film is taken while it was the inspiratory phase. We start counting these posterior ribs, and if I can count from 1 till 10, it means there is full inspiration. Remember, there are always compromises. So what is acceptable? If we cannot count the 10 posterior ribs, but if we can count something in between 7 to 8, that is equally acceptable. So first thing was penetration. Second thing is counting of these posterior ribs for determining the inspiratory phase. And the third factor, we should be look for the rotation, that what is the status of the patient. So for that, we need to look for these clavicles. I'm sure everybody can see this clavicle on both the sides. Let me draw it for you. And then what we have in the middle, this is the vertebral body. And there what we are looking at, we should be looking at the spinous process. If it is in the middle, it means everything is fine and there is no rotation. And then another point, and that will tell me about the angulation. How I determine the angulation? For that I have to erase this little bit here. I need to erase all that. So now I'm looking for, so let me redraw it. This was my clavicle. We all know about that. Now there you can see very clearly this is my first rib. Now what I'm trying to show you, we all know this is the medial end of my clavicle. It superimposes, it goes above my first rib. So if that is there, it means there is no angulation. So we are done with this point of that. Then we should be able to see these domes of the diaphragm. That is another important factor. Now, after looking for these 5 things, now let's start identifying the structure according to our earlier understanding of ABC, DNA. So now for that, if you pay attention, can you see this area which is slightly darker? Can you clearly see that which is in between these 2 lines? That is my trachea. And we all know trachea is a windpipe. After that, can you see this area which is being very clearly highlighted? What is that area? That is my aortic knob or aortic knuckle. This is a term which is very commonly used by radiologists. Then we can see this is an area where we can see the pulmonary artery. And after saying that, now let's look at this is my, we are looking at what? We are looking at the left ventricle of the heart. If someone asks me, what are those structures who makes the left border of my heart, I can simply say the aortic knuckle or aortic knob, pulmonary artery and left ventricle. They are making the left border of my heart. Now, let's make the right border. So for the right border, we can see very clearly, this is the location where we can see either the superior vena cava and the ascending aorta. So this is one structure. The second structure you can see very clearly here, and that is what? So this what I said, it was superior vena cava. And now what is this structure? That is my right atrium of the heart. Regarding inferior vena cava, if you really are very focused, you may see it here. That is my inferior vena cava. So now these are the structures on the right side. They contribute in making the right border of my heart. After saying that, to see the more structures, let's delete all of them. Let's erase them. Now just pay attention. We all said this is the dome of the diaphragm. And this one is my body wall, thoracic body wall. Now if you pay attention, you can notice here there is an angle, and this is my costophrenic angle. And this costophrenic angle we can see on both the sides. It's a very important landmark. And this is because of my costodiaphragmatic recess. If we have any amount of fluid, and if the X-ray is taken when patient is standing, this fluid will come, a minimal quantity of fluid will come and start accumulating, start obliterating this angle. And then we can label it simply by saying pleural effusion. So this is the significance of this costophrenic angle or costodiaphragmatic angle. And this is because of my costodiaphragmatic recess. After seeing this, now just pay attention. You can see these lines. What are these lines? These are my markings of the blood vessels. After seeing these markings, let me erase them. Now we can pay attention on these two areas. What are these two areas? These are my at the right hilum, right pulmonary artery. So you are looking at right pulmonary artery, and this is on the left side is my left pulmonary artery. And if you can just look at them, they are not at the same level. What is the difference? Left hilum is normally slightly higher than the right. And this is what we can see very clearly at this angle. Are we clear about this? So these are the simple things which are very clearly visible in this X-ray. We have more details, but this is good for the beginner level. Now, let's proceed for this lateral view. And what we look in this lateral view, first of all, let's have the clear-cut orientation. So now this what we are looking at is the sternum, which is in front. This is where my heart shadow. This is my diaphragm. This is my vertebral body. So this is a broad organization. So let's start working on this one by one. What are we looking into this lateral view? Lateral view is really important. And there are 5 key areas. What are these 5 key areas? These 5 key areas are, let's start. This is my area number 1. And what is that? We call it retrosternal area. You can see this outlines. So this retrosternal area it has to be clear. The second point, there you can see the hilar region. The third point is the fissure. I'll be showing you shortly. And then we can see the vertebral bodies. And the last, we should be looking at the diaphragm and costodiaphragmatic recess. So where is the diaphragm here? We can see very clearly one dome and the other dome of the diaphragm. And then where is my recess? The angle and recess is here. Now, we can see this retrosternal area. And then what we can see here, this is my hilar region. We have talked about it. Now, what is so pertinent about these vertebral bodies? Look at these vertebral bodies. Look at their dimension. What is different here? The vertebral bodies are approximately of equal height and their end plates are parallel to each other. That's important. And then what we can see, this point, the posterior costophrenic angle has to be sharp, has to be acute. And then we should notice another very important area. And what is that area? Let me highlight him. I like to use a different color. So if you can pay attention, this is my posterior aspect of the heart. This is in front of the vertebral bodies and this is above the diaphragm. I'm talking about this area. This is a space which is posterior to my heart and anterior to the spine. And this is really important when we are determining on the basis of an X-ray about the size of the heart and we are looking for cardiomegaly. We should look for this triangular area. Then we have some more important structure. For that, I need to erase all of them. And what's that? Let me select the color here. And if you can pay attention, can you see this line? And let me draw another line for you. So what are these two lines? This line is what? It represents what? The major fissure. And this line, that represents the minor fissure. And these lines are really important. Now, before we go, we need to remember one point. If we are looking into an X-ray chest and we see it's too light, what does it mean? It is not penetrated properly. So it is under penetration. So what are the possibilities? We can make mistakes. So first we can say the left hemidiaphragm may not be visible on the frontal image because of the left lung base may appear opaque. And this technical artifact, we can mimic that, oh, this is a case of left lower lobe pneumonia or left pleural effusion. The second point, if the pulmonary markings are very prominent, so then we can mimic, oh, this is a case of congestive heart failure. That's why it's always said when you are commenting on any X-ray, you should be very careful with the clinical findings and you need to correlate always. Now, vice versa, if the X-ray appears over-penetrated. So now, we mistakenly thinking what? So the lung is appearing dark. So now we can mix it with emphysema or pneumothorax and we cannot pick them. So that is really important if we are handling with a person who's having emphysema or pneumothorax. And if image is overexposed, like if it's over penetrated, then we might miss these diagnoses. So now let's summarize. Be systematic And that should be your habit. Do the same thing every time. And initially look for who, what, why, where, and when. And then look for the quality of the image. Always follow A, B, C, D, E approach, and then look for the lines and tubes, because these x-rays are from the patients, and we should be seeing some additional structure, may have some endotracheal tube, nasogastric tube, central venous lines, and chest drains and all other things. So that we need to very clear about before commenting or reporting on any given x-ray.